Hi guys, today we're going to talk about the internal oblique. So the first thing that we're going to look at is where exactly is the muscle at? So we have a lateral view of the internal oblique here. I'm going to show you an anterior side of this, but it's just going to kind of show you where the insertions and the origins are. So here we have the insertions, which are going to be in the red. So the insertions are going to be on the internal surface of the lower three ribs, as well as the rectus sheath to the linea alba. The linea alba is just going to be this red line that you see here, where it's showing on the spine, and then the lower three ribs internally are going to be also where it shows the redness here. So that's where the muscle is going to insert. So we go back here, that insertion would be on the lower three ribs internally, and then we also have on that you can't really see it from this angle, but on the linea alba of the spine. So it could be like back here. For origin, it is going to originate on the iliac crest. It is also going to originate on the thoracocolumbar fascia and the lateral inguinal ligaments. So if we go back here, we're going to see those that are origin on that iliac crest in this general area. As for the line of pull, I'm unable to use animation or drawing here, so I drew a little version on a whiteboard, right? So for the line of pull, not the greatest drawing, but let's see if you can see that. Why should it's going? Let's stop this shader. And then, okay. Here we go. So we have the lateral view, okay? So we have the iliac crest here. These are going to be our ribs. This is going to be the internal oblique. So with the internal oblique, what is going to happen is it is going to, the line of pull is going to be going down. So if I'm here, it's going to be going toward the iliac crest. So it's pulling down. Essentially, what this is doing is the internal oblique is pulling to the same side for rotation. So as we rotate, whenever we're rotating to the left, that's your left internal oblique rotating you down to that same exact side. So we've covered insertion, we've covered origin, nerves. We did not cover the nerve. The nerve. The nerve is going to be T7 through T12, as well as L1. So this is going to be the ventral rami nerves and the ilio and inguinal nerve. I'm not sure exactly how to say it, but those are the nerves. So the vertebrae that go along with that are T7 through T12 plus L1. Those are the nerves. So now we went over origin, insertion, nerve, and line of pull. Last, I just want to give you like a fun little fact. So one thing that I found interesting is with the internal oblique, this is a very important muscle for dancers, specifically dancers who do ballet or any contemporary type of movement. Whenever they're doing their graceful turns, things like that, this muscle is very important to keep the upright posture and do the skill correctly, as well as other abdominal muscles as well, but this one plays a big role in executing those turns correctly. So that is the internal oblique. Thank you.